So Peter, if we could go to you for your Chief Executive's report, please.
Yes, thank you, Chair. I'll pick out a couple of key points, as I do tend to on these occasions, and happy at the end to take any questions. So firstly, you'll note at the front of the document, we describe the immense effort that the organisation went to and effort that they went through over 2020. I think there's something a bit cathartic about writing it all down and presenting it as we have, because it indicates the enormity of the challenge and, as I say, the effort that we went to as an organisation. So as we enter the new year, I suppose it is appropriate to say a huge thank you for the work that people have done following on from the piece, indeed, that we've just mentioned in terms of Nikki's input. She is one of a number of people that have gone hugely above and beyond to help us manage through that phase of the pandemic. Secondly, I'd like to just touch on the strategy progress. So as you will all be aware, we launched a month or so ago our strategy through this digital means, and that by no means was the end of the journey. In fact, it was only the beginning. So as you will see within the notes, we've got a number of mechanisms, a number of channels to communicate, discuss and evolve that strategy with both internal and external stakeholders. So I'm really excited by the next period of time, what that provides to us in terms of an opportunity to have those conversations and elaborate on the 4 key strategic themes that we have, but also evolve what I would term as a clinical transformation plan that we hope to have in place for April, for the start of the new financial year, that we describe in strategic terms, i.e. a 3 to 5 year period, what our specific deliverables are over that period around clinical transformation. We've got some huge programs of work that we are embarking on, whether that be dormitories for inpatients or community transformation of our mental health community services. So I see that as a great opportunity to showcase those various programs of work. So watch this space in relation to that. Third, you'll see that the staff survey closed a month or so ago, and I'm delighted to say that we've had the highest response rate throughout the time that the staff survey has been running. Results not quite with us yet in detail, but they will be shortly, and rest assured once they are, we will of course debate and discuss them in the way that historically we always have, ensuring that we address any concerns and showcase all the good stuff that I'm sure will come through from those survey results. A couple of final items. So firstly, I'm delighted to not quite welcome in, he's not quite here yet, but to announce Eric Gardner's appointment to the role of Finance Director. I'm sure there will be various points when we can appropriately embarrass Lorraine for her wonderful efforts over over the last couple of years, but we're not quite there yet, in that Lorraine will be with us for another month or so, and Eric's planned indicative start date is the 1st of April. So there will be little gap between Lorraine's departure and Eric's commencement, and as you can see, Eric comes from a role at the moment that is a pretty high profile, complex one, and he will of course be entering into a world that is also high profile and complex. So I'm sure when he arrives you will all welcome and congratulate Eric on his appointment. And the last piece is of course and not surprisingly around COVID and the pressures that we're facing at the moment. It's a very sobering situation, it has to be said. The wider system, as I'm sure you will all be aware, is under immense pressure. We within Combined are controlling the situation well. Our level of COVID positive patients within Harplands as inpatients is relatively low, and we are doing what we can to support the system, whilst at the same time, of course, making sure we provide core mental health and learning disability services, which is our remit. So you will see within the details some of the things that we are doing to support the system, including the ring fencing of a certain amount of capacity to support discharge and flow through the system out of UHNM. The hope is that we will shortly become a vaccination hub, although that's been complicated over the last day or so in terms of national approval processes, but I'm still optimistic that will occur. So we are going above and beyond to support system pressures, which are massive at the moment, perhaps more than they've ever been in relation to COVID. But at the same time, of course, ensuring that we do fulfil our core duties in relation to our patient cohorts around mental health and learning disabilities. That's all I wanted to pull out. I am, as always, happy to take any questions or comments.
Thank you, Peter. Jenny, I think your hand was up first.
Right, thank you. I mean, a couple of things. First of all, I wanted to, you mentioned your report about the passing of Hilda Johnson, and I just wanted to mention a few words about Hilda. I've known Hilda for many years, firstly through her attendance at board, and she's attended the board for many, many years. And interestingly, it's mentioned the Reach Awards and her work actually within the Reach Awards. I sat on many judging panels with Hilda. Not only was she an advocate for patients, users and staff, user council, she was a real advocate for staff. Many times at boards, who sat at boards, and she would raise concerns over her staff, you know, things that when she spoke to staff, and really supportive of us as trade unions, but really supportive of all our staff as well as service users. So I'm really devastated to hear that news, and everybody, I've never heard anybody say anything but fond words about Hilda, and she was so passionate about what she did. So I really appreciate that you've mentioned Hilda in your report, Peter. I think it's really important. Just slightly a bit more prosaically, there's a mention here of the system and the move towards our integrated care system and away from CCGs. I just wanted to ask the question: is it felt that, and it feels rather prosaic, doesn't it, with COVID and everything else we're talking about, longer term things, but do we feel that move will give us more stability as a provider and maybe less of the let's tender every service we can, every opportunity, which we know for provider and our trust has really disrupted things? So is there a feel that bringing us more together will help with that? Because that's certainly what we would support.
Yeah. So I'll second the comments with regard to Hilda, and although I didn't know her very well, I know a number of colleagues on the board that did and loved her very much. So absolutely, thank you for mentioning that, Jenny. With regard to the point around system development, I'll go as far as to say evolution. I do think that it does move the focus away from competition and more to collaboration. We still will have, I suppose, the point about competition, to an extent, at least back in the days of Monitor and the like, was that was a key focus around achieving value for money, efficiency and effectiveness, but that was focused very much so on individual organisations. So I remember having conversations with Monitor back in 2015, 16, something like that, saying we need to move the focus more to systems and away from individual organisations in terms of efficiency. That was when I had a finance director hat on, because we are we're at the bone essentially when it comes down to individual organisation efficiency. The point I was getting at was that we were missing a huge trick with system-wide opportunity in terms of operating in a more effective way. Back then, that conversation, the response from the regulator was, yes, we are starting to think in that way a lot more, which was great. But like anything in the public sector, things can move quite slowly. And it's been obviously a gradual progression from that point to now, and will continue to be relatively gradual, I would imagine, in terms of system development. But I would say that there are aspects that are within our control that don't need legislative change, for example, to be enacted. So the creation of integrated care providers is one example, I would say, of that move to partnership working that is to a large extent within our control. A lot of work still to do, don't get me wrong, but is within our grasp. And there'll be a few items perhaps today that we'll debate later on that will talk about that principle of giving providers more ability to affect and influence change as a collective, which is key to all of that. So that was the long version. The short version is yes.
Thank you.
Joan, do you have a question, comment? You're on mute, Joan.
Sorry, apologies. No, I wanted to just add thanks to what Jenny added to what was said about Hilda as well. The question that I've got, if I may, it's in relation to the possibility of Harplands being a hub in terms of the vaccines. And I just, excuse me, I'm losing my voice. I just wondered whether or not there's a sort of strategic debate that we perhaps need to have about vaccines and about the rollout of vaccines. And it's obviously going to be a really important step forward if we can do that with all the professionalism that we would bring to that and the support for healthcare workers. But I just wonder whether or not at some place somewhere there's a conversation that we need to have whereby we are supporting the value of vaccines given by our local GPs and by local pharmacists as well as the absolute basis on which the rollout of vaccines should be. And given the key role that we're playing in the ICP developments, you know, and how that is going forward, I just think that combined healthcare trusts having a sort of basis for how we see the vaccines being rolled out, not just over the next few months, but over the next 10 years, could help actually define what the system's approach is and our contribution to that system and our leadership role in that system, about the value particularly of local GPs who know the local public health scene, who are in touch with their patients and who do not wish to be undermined by the opportunity of kind of bigger rollout of vaccines in other places. I just think it would be helpful to understand what our role and position is on that.
Okay. If I can begin and respond to that, and then others may wish to come in, other execs. So the first point I suppose I'll make is that the hub that I described a moment ago is still under discussion. I personally am optimistic and hope that we do get authorisation to become a hub. That would, in the first instance, be a staff vaccination hub. So that would support the vaccinating of our circa 1,700 staff, many of whom have already had their first dose, but a number still have not. What that would provide us with, which is key for me, is a level of control over the flow of vaccines to our staff. Without that hub, we are more reliant on other partners within the system to enable us to fully vaccinate our staff, albeit with the first dose. So for me, there's an immediate imperative to maximise our ability to influence the vaccination of our staff, and that mechanism would enable that. That is not to say that without that hub being created, we would not be able to relatively quickly vaccinate our remaining staff. We have access to other organisations' vaccination facilities. It would just mean that there was a further step to go through to enable us to be fully covered. In terms of general practice and other partners, we have a mechanism in the system now. We have a governance process. Neil Carr is the Senior Responsible Officer for the vaccination programme, assisted by Paddy Hannigan, who is the chair of one of our CCGs. So we have a governance process, a mechanism and an infrastructure to manage the process. It is very complicated. To be fair to those that are managing it, it is very complicated. The regulator is watching the process very closely, and I think will provide more information gradually over time in relation to vaccination activity. you may not be aware, but we will post information in terms of first and second dose vaccinations given out to the centre, and have had little access to that information to date, but we will receive more and more of that information back over time, which obviously is going to be helpful to us in terms of the management of the vaccination process. So it's evolving. It's all hands to the pump to an extent, because it is the solution, but it is evolving. The more strategic piece, I agree that we should be involved in those conversations over time, needing to be careful not to push an agenda that, frankly, people will feel is a little premature given the immediacy of the current task. So, being sympathetic and empathetic to the current situation and where people are at. But more strategically, yes, we have a facility, a site that is relatively easily accessible. It's all on ground level. It's quite open. If we operate in a not dissimilar way to how we do now, it will mean that we will have some car parking capacity potentially available, etc., etc., etc. So there is opportunity for us going forward, but doing that in a system-wide way with partners. So offering up what we have relative to other partners, and I'm sure there will be a place for us. I don't know if other colleagues who've been close to the detail over recent days want to say anything more.
Jonathan, I can see Russell's waiting, but I'll go to Jonathan next if I may, Russell.
Yeah, just to say, obviously, at the moment, I think, just to add to what Peter said, we are at this moment in time at the behest of central government in terms of vaccine supply. So we're absolutely, Joan, we're ready to go. We're ready to support the system. It's all in hand. In fact, I believe right now that Liz Mellor, my deputy, is sat in the regional vaccination programme board on the behalf of Kenny and I. So we are linked in, and I think over time we will have influence, but I think where we're at this moment in time is we're waiting for vaccine to be delivered as soon as possible so we can take action. And I think perhaps in 6 or 8 weeks we'll start as a system to think about the long term, and we'll be linked into those. But that's all I'd say for now.
Thank you very much, John. Russell, you have a question?
Actually, a couple of comments, if I may, Chair, really quickly. First of all, I'd like to put on record my thanks to Shajida and the team for the 61% achieved in the staff survey. I've been one of the people, along with Janet and others in the People Committee, let's just say encouraging Shajida to shoot high. I'll just say here, we did set them the informal target of breaking 60%, and they've beaten that, so well done. And it's a great start as we push on to the sunny uplands of 70% plus, but let's just celebrate the success for now. I think it's great work. Secondly, just a really quick cheeky mention for the finance team. We mentioned Lorraine, and we'll come on to her next month or whatever. But in terms of achievements in 2020, I just want to say I think the finance team have done a great job. They've been navigating through changing guidance. It's not put them off their stride. We've kept in surplus. They've been doing great early planning for 21, 22, and they've also been delivering some innovation in the background there. So a quick early cheeky mention for the finance team in terms of achievements, just to acknowledge their work. And I've not been paid for that by Lorraine, not yet at least.
You'll have to declare that when it happens, of course, Russell.
I will put it in the register.
Thank you very much. Any other questions or comments for Peter?